We know the service needs to transform, but the immediate priority is obviously to recover the services that have been affected by COVID.
Only a quarter of people believe the NHS is working. That's according to analysis by the King's Fund Health think tank. It's a historic low for satisfaction figures, with experts saying people feel trapped in a toxic relationship with the service. When asked about satisfaction figures, the Science Minister, Andrew Griffith, insisted to Times Radio Breakfast that the figures are in context of the pandemic.
No one should be complacent about today's figures, to be absolutely clear. But it is in the context of that COVID pandemic. And again, not to look for the silver linings, but in Labour-run Wales, the level of dissatisfaction is significantly higher than it is in England.
Yeah, OK. Well, we are talking about all of the UK, and we are joined by the Chief Strategy Officer for NHS England, just to point out that difference. Chris Hopson joins us now on the show. Good afternoon, Chris.
Good afternoon, Kate.
The Science Minister there kind of roundly blaming the pandemic for the issues, the low satisfaction record low satisfaction with the NHS. What do you think about what he's had to say?
Well, look, every advanced Western health system is in the process of recovering from COVID. There were many amazing things that the NHS did during the pandemic. We had that world-leading vaccination campaign. We led the world in terms of researching and then rolling out antivirals that effectively dealt with the worst symptoms. We expanded critical care at the drop of a hat. But the downside of COVID and what happened was it's left us with a very significant set of backlogs. Now, we are starting to work through those backlogs, but it is and will take time. So there is no doubt that COVID has had a very significant impact, not just on our NHS, but through every other healthcare system in every advanced Western nation.
Is it just about COVID, though? Because the satisfaction levels with the NHS have been falling quite significantly. They were at 70% in 2010. So I wonder whether that sort of COVID excuse stands really for longer, more endemic issues within the NHS.
So if you don't mind, I think excuse feels a slightly pejorative word. I think the reality is that frontline staff are working incredibly hard. We've set out really clearly how we're going to get through those backlogs. We set out a plan for how we were going to improve urgent and emergency care. We added 5,000 extra beds over this winter. We added extra ambulance capacity, extra 111 call handling capacity, and we have seen improvement in performance. We were very clear that we wanted to make it easier for people to get access to an appointment in general practice. We're now doing 50 million more appointments in general practice every year compared to before the pandemic.
So why do you think, sorry to interrupt you, but why are the public then saying that they have record levels, low levels of satisfaction with the NHS? We know about all the things you're doing, but I want to get to the heart of this data here and sort of find out why people are so dissatisfied and sort of why that dissatisfaction has been tumbling over a period of years before the pandemic became a discussion.
So what the data shows you really clearly is that when patients can get access to care, they actually, and again, this is confirmed by all our internal evidence as well, when they can get access to care, they are very happy as a rule with the quality of care they get offered. The issue is getting access to care. And despite all of the hard work at the front line, we absolutely know that there are too many people who are having to wait too long for care to arrive. And that's what the dissatisfaction is. If you actually ask people, again, if you go back to the kind of the survey, what the survey says is that is the top cause of dissatisfaction, the fact that actually people can't get timely access to care. And yes, look, I think if you actually look at NHS performance, there was no doubt that before the pandemic, as a result of the pressures the service was experiencing, there has been a gap between growing levels of demand and the capacity that the NHS has to meet that demand. But so what we're saying is, as you recover from COVID, we're very clear about what the recovery strategy needs to be. We're focusing on improving waiting times in terms of accident and emergency, cutting the waiting lists and ensuring that we make it easier to see a GP.
Yeah.
And if you look what happened over the last 12 months, you'll find that in each of those areas that we've been prioritizing, we have started to recover services. But look, everybody in the NHS knows there is still some way to go. And that's not just the entire picture, because as well as recovering services, we know that longer term we need to transform the NHS.
Yeah, so the report suggests that the difficulty of seeing a GP was the biggest source of frustration for people. And I think, Chris, what I'm honestly asking is it all about trying to recover after COVID, or does there need to be some acceptance that some of the issues with the NHS were already long there before COVID? Can we be honest about that?
So what we're saying is that we know we need to recover services, but longer term, we absolutely need to transform the NHS. Look, the number of people living with major illness is projected to increase by 2.5 million people, 37% by 2040. We know that over 85s are the biggest users of the NHS, but they're the fastest growing age group. So we know that what will happen is the number of 85s, it's tripled since the 1970s, and it will double again over the next 25 years to 2.6 million people. So what we know is we have to transform the NHS. But Kate, the really interesting bit is if you look at literally, I slightly counted it up the other day, there were about 140 papers reports have been written over the last 2 years about how the NHS needs to transform. And what is remarkable is there is a huge level of agreement about what the 3 things we need to do to transform are. We need to use digital technology, better data, and 21st century medicine. That's the first thing. The second is we need to bring care closer to home so that we reserve acute hospital treatment for those who really need it and integrate health and care. And the third bit we absolutely have to do is we need to ensure that we're not just a service, but also a society that treats illness. We need to get better at preventing illness and supporting people to look after their own health and well-being.
Okay.
So we know the service needs to transform, but the immediate priority is obviously to recover the services that have been affected by COVID.
Okay, all right, thank you. Just stay with us, Chris, if you can. Chris Hopson there, Chief Strategy Officer for NHS England. I want to bring in Professor Kristoff Lee. He's an NHS consultant with decades of experience. He works at a London teaching hospital. Kristoff, thanks for being with us. We've talked about some of the solutions, and Chris has put forward some of the solutions there. But from your experience working in the NHS, tell us what you would like to see, where the main issue is for you.
Well, I think the first thing to say is I agree largely with Chris on many of his analyses. But what I would say is that the real issue is too much demand and not quite enough supply. So there's always been this capacity problem in the NHS. I was just reflecting when I started in medical school in 1984, I remember the headlines, NHS in crisis, and this has been a recurrent theme for many, many years. Now, how you deal with that is the key question. Now, what Chris Hopson said about digital health, care closer to home, and these other aspects of care,
societal changes,
societal change, absolutely right. But those don't happen immediately. I think what I would observe is that to get towards a health service that is better funded, has less in the way of bottlenecks, we need to consider harnessing voluntary contributions. And by voluntary contributions, I'm not talking about private healthcare insurance schemes, but what I'm talking about is schemes very similar to the original Beveridge model back in 1941. William Beveridge, who was an LSE liberal, set up the basic fundamentals for social insurance, which are practiced throughout many European countries and further beyond now. And it's worth saying that virtually every healthcare system is in a funding crisis at the moment. So there is not a perfect system.
How would that work, Chris? So we obviously contribute towards the NHS via our taxes. And of course, the more money we earn, the more of our tax goes towards the NHS. So if you're better off, then you are contributing more to the NHS. How would voluntary contributions work?
Yeah, but so I've been working with think tanks and other groups for the last 2 decades, actually, on thinking about how we can introduce some sort of contribution that would allow a contribution to the NHS, but at the same time allow people to put what's called the NHS tariff to specific aspects of care, to the independent sector, charitable hospitals, private hospitals, or foundation trusts, or use contribution for amenity beds or gym memberships or whatever. So you've got a virtuous circle there with individuals or families that are willing to contribute extra per month, let's say 50, £100 a month, then having the right to port a certain amount of the tariff to other providers. Now,
private providers are we talking about here?
Private providers, independent sector providers, foundation trusts that can provide services at a charge now, amenity beds, which are provided in virtually every NHS hospital now. And it doesn't have to be private providers because, of course, the NHS does do a lot of provision and does have add-ons. We have a dental system that, of course, doesn't is in severe difficulties. So what we're really talking about is voluntary contribution. There is a lot of allergy towards general tax, increasing taxes and increasing tax revenue to the NHS. So why not consider a system where those that want to contribute can contribute?
Okay. Kristoff, thank you so much for getting that across. I must go to Chris Hopson again before we finish the item, but I want to thank you for putting your thoughts forward. It's an interesting discussion to have. Professor Kristoff Lee is NHS consultant at a London teaching hospital. Chris Hopson, I know you have to go shortly, but I want your opinion, please. Could something like voluntary contributions by individuals, by families work when we talk about long-term sustainability for the NHS and more people being able to access more services in a more timely manner?
Well, so look, how the NHS is funded is a matter for government. It's not a matter for me. But let's just say two things. First of all, if you look at the survey data today, I thought it was really interesting that 91% of people supported the NHS being free of charge when you need it. 82% of people supported the NHS being primarily funded through taxation. 82% supported the service being available to everyone. And if you look at what the big experts have said about moves to social insurance, your own Times Commission said the key question is not how a country raises the money, but how it spends it. The King's Fund have basically said that there's no evidence that suggests that any specific funding model routinely delivers a better healthcare system. And the Institute for Government said that a switch to social insurance would take years for an uncertain gain and would likely be a distraction from tackling the issues that need tackling. But as I said, in the end, it's not for NHS England to determine how the system gets funded. It's actually an issue for government.
Thank you so much for speaking to us. Some really interesting thoughts and things to chew over there as we work through this story. Chris Hopson, Chief Strategy Officer for NHS England. Thank you to you, and earlier to Professor Kristoff Lees.